Hello everyone, welcome to BraveHearts. This is Shanling. Today we will talk about the COVID-19 new mutants in United Kingdom as well as in South Africa. Because in the last week, this has been a major topic and global concern. And in United Kingdom, many people were forced into tier 4 stage of protecting themselves. So many people have to be locked down at homes. And globally, many other countries has also found out that the new mutants from United Kingdom may already emerge in their countries, such as Japan, Australia, and Canada as well. So even in the United States, the CDCs and DHS and HHS has not formally announced that this new mutant arrived in the United States, but people has been very much alert about the situation. So today we're going to talk about these mutants. So first, let me show you these current situations in United Kingdom. So let's look at the coronavirus tier 4, but basically this is ordered as stay at home. So for stay at home, we have to make sure that people understand the rules that United Kingdom has put out in terms of tier 4. So the order says you must not leave home except for specific purpose, food, medical reasons, or works, and also do not travel unnecessarily, and work from home if you can, as well only up to 2 people can meet in public outdoor space. Basically, there is no public gathering at all in United Kingdom. So this is a serious situation. And so let's look at some statistics here. So in here, this is a statistic in the United Kingdom. You can say even just in the last 7 days, more than 256,000 people has been tested positive, and daily number is 41,385. And this is the total positive case. And then for the death case, within the last month, the 28 days, the positive test, basically daily you have 357 cases. So this is a serious jump for death case number since June, July this year. So definitely, United Kingdom is facing the second major peak. And then if we look at the third column, we see the patient being admitted. And in the last 7 days, 14,000 people and 24 patients has been admitted into the hospital. So this is actually a very significant number, much more important than people testing positive, because a lot of people testing positive, they may not have symptoms. So the hospitalization data is really critical to show the burden of the current medical system in United Kingdom, as well whether the disease showing a sign that more and more people have medium level or severe disease. So these numbers, let's keep in mind, is very important, and it jumped 16.5%. And then for viral testing conducted, definitely United Kingdom has done even bigger scale of testing for the whole nation. And so in the last 7 days, 3 million people has been 3 million testing has been conducted. So this is a huge increase on this capacity as well as in operation. So this is important data, and in United Kingdom, we understand the government right now, try to make people stay at home. And based on this data, they have to roll out this kind of policy. And we can look at another figure. This is also cumulative data, and also we can look at this trend of this number of people being daily tested positive. So you can see from May to July and September, there's a significant drop in the positive case. But after November, the case number severely increased. So there's a definitely, I think the UK should even alert the public much earlier than December. So I think probably in the middle of November, the government should take more proactive measures. If we look at another figure, so this one is in the showing in the last 7 days, in the last 1 week, how many cases has been appeared in the population of the United Kingdom. So you can see there's also a significant jump of the case numbers since December 6th. And so right now the trend still not slowing down. And so then we can look at the patients in UK hospitals. So this is very, very big jump. So definitely in UK is showing like 2 peak. And so you can see the climbing actually started in the middle of October, and by late October, the trend of increase is really, really significant, and it's a very sharp increase. So to look in more detailed analysis of this population being infected, I think these table, these diagram definitely show an important alert to the public, because you can see this one is diagram showing the age difference among people being infected by COVID-19. And you can see the orange columns is actually pre-existing variants that circulated in the UK populations, and the green one is the new variant. The variant's name is VOC 2020 December 01. And it's a clear difference that people from people younger than age 20 have a significant increase in their positive cases, right? So very significant difference. In here we can see. So basically you can see these populations definitely has significant jump. This younger population, younger than 20 years old, being infected by these new variants. While in the past, definitely adult and elderly people are more easily being infected. So this is a huge difference. So what caused this difference? And we can take a look at the mutants, right? So in the summer, we started to know there's a very important mutant happen in the population and become dominant in the society. And this mutant is D614G. So these mutant, even though just one single amino acid mutation from D to G and to glycine, but this mutation definitely showing that this viral mutant have a greater transmissibility, greater infectivity as well. And this has been proven not only in vitro cell line infection, but also in human airway models, as well as in hamster animal model studies. So it's very clear that virus developed a strategy. So after the outbreak from Wuhan, the virus start to find the mutant that can spread faster with higher transmissibility, and this strain actually become dominant pretty much globally. At the beginning, it was become dominant in Europe, and then it spread out globally. So this is a very important strategy for the virus. First, so basically they first try to find a viral mutant that has the best fitness. They can grow faster in human society, right? Circulate faster, spread out faster. So this is this particular mutation, and it's only one single mutation in. If you show the diagram again, you can see it's near the end of the S1 protein in the spike proteins. So, and now this time it's different. And if we look at these new mutations in United Kingdoms, as well, we heard about the mutants in South Africa, right? So basically, there are several important mutations being circulating, but in here we're highlighting 3 of them. So the first one is the UK's B117. This is a lineage number, B117, but the name of the variant is called VOC, Variant of Concern 2012. And this one has 7 non-synonymous mutations. So 17 change that cause amino acid change, either change to another amino acid or it's a deletion. And the new studies from London School of Hygiene and Tropical Medicine has a report. It's not published yet, but it's in peer review. These reports showing that these new mutants, the B117 mutant, showing 56% more transmissible than the existing strains. And it has become the dominant strain in several parts of the United Kingdom, such as London and southeast part of the UK. And now this variant is believed to be in at least 7 countries. So these mutants is the most alarming mutants and make the whole world pay close attention to the United Kingdom's pandemic situation. And that's why many countries even close their borders to the British people. And then we also heard about the report from South Africa. So there's another mutant, it's called 501 V2 strain. And this strain also has a lot of mutations, including mutation in the spike proteins, and it also have very important mutants in the 501 position. So I'll mention that later. And it's important to know this mutant, or you can call it lineage, is distinct from the B117 from UK, and it does not include some of the same changes. But these variants has been seen in South Africa as well as in United Kingdom. So this strain also has been spread into United Kingdom. And then another one is rarely mentioned is it's called Welsh 501 Y variants. So this mutant also have the mutations from asparagine to tyrosine at the 501 position in the spike protein of the SARS-CoV-2. So this lineage is also distinct from the B117, and it does not include some of the same changes. And this has been circulating in UK's Wales since the autumn, but has not spread rapidly. So definitely there are other mutations in these SARS-CoV-2 spike proteins or in the whole genome that contribute to the different speed of spreading of these different variants. Okay. So basically, I'm trying to emphasize it's not just the mutation in the spike that will influence the transmissibility. Probably other mutation will also influence virus transmissibility as well as infectivity. So these mutations is not an isolated event. We definitely need to look at the whole viral genome and look at the interaction between different mutants, probably also the conformational change that triggered by different mutations, and how the mutants can evade immune systems attack, and so how the virus can find the best fitness as well can maintain its lethality or causing similar degree of pathogenicity. This is also very critical for the virus to spread out faster as well as maintain its pathogenesis. Right. So next one, I want to look at more in depth into the mutants. So now we look at the mutants in the VOC 2020-12-1, the B117 mutants. So basically, this one mutant has 23 mutations, and among them, 17 of them are non-synonymous. So it can cause amino acid changes. So in here, you can see many mutations. and we can see it has mutation in open reading frame 1AB in the spike protein, many mutations, and then also in the open reading frame 8, as well as in the N protein structure proteins. And in here, the most important one is the N501Y, right, asparagine to tyrosine change. And then it has a very important deletions. This is two double deletion at a position 69 to 70, 2 amino acid deleted. And then you have another important mutant, is P681H, that is proline to histidine changes at 681 position. So the deletion 69, 70, this one is particularly interesting because these deletions, it has actually make the detection of these variants more convenient, because these deletion causing the current nucleic acid assay that being widely used in the United Kingdom cannot detect the spike protein. The spike protein is an S protein, right? So because of this deletion, the commercial assays, they usually have 3 targets. One target is the open reading frame 1, the other target is S protein, and the third target is N protein. So because of this deletion, the nucleic acid test, right? So it cannot recognize these S protein. So it cannot recognize these S protein. So 3 target, only 2 being left. So if you have the previous circulating virus strain, then you will have 3 positives. And if you have the new variants, then you will have only 2 positives. So it's actually a convenient tool to identify these United Kingdom strain, the VOC 2020-12 new strain. But if we look at these differences, I think we need to also think from another perspective. So why just 2 amino acid mutants making the S proteins cannot be recognized in this nucleic acid assay? So this nucleic acid assay basically is a polymerase chain reaction assay. So it amplified one region in the spike protein. So if you have 2 amino acid deletion in these regions and causing a big conformational change, or alternatively is the probe that try to recognize these specific region in the spike protein lost its function, so basically the probe cannot recognize its template, then the assays won't recognize the S protein. So these 2 potential, one is the probe doesn't work anymore, and the second potential is that the virus has certain conformational change. So if it is due to the conformational change, then it actually rings a bell, because it means the spike protein may have a significant conformational change, and these will lead to very important issues, because then the antibodies recognize the spike proteins. Some of the antibody may not work, right? If the virus spike protein have significant conformational change, so that's actually a very big issue. And then we also need to pay attention to the N501Y, because the N501Y mutant is happen in the receptor binding motif. Receptor binding motif is the critical regions in the receptor binding domain of the spike protein, and these motif is in charge into the interaction between the receptor and the spike protein. So in this way, if the mutation happen in this region, it will definitely alter the affinity between the receptor and the spike protein. So the N501Y is one important mutant in the receptor binding domain. And then the P681H, if we look at the table here, the P681H is a mutation near the furin cleavage site. And so that's why it will also affect the virus spike proteins conformation, because it's in near the furin cleavage site, and that is a hinge area. It's very important for the conformation or stability of the spike protein, as well. It may influence the pre-fusion conformation of the spike protein. And then there are other mutants in the Q27 stop in the open reading frame 8. And these mutants, the Q27 stop mutant, so it will make aberrant open reading frame 8 proteins. So these will also influence the virus immune evasion capability. So that's why you have the several key mutation that can influence the virus transmissibility as well as immune evasion. So that's why this mutant is particularly alarming. But at the same time, I want to point out, of course, the virus mutates all the times, and these mutants from South Africa as well as in the United Kingdom, they have multiple mutations in these lineage or in this strain. It's not very, very common situation to see so many mutants suddenly appear in one particular mutant. Usually the virus evolves and mutates gradually, and it has a process. Not so many mutants kind of all jump out at one strain, right? So what happened? So the media have not been focused on one critical issue, is how the mutant evolved. And looking into some of the previous reports, we found out this actually related to the patients. The virus mutant was identified from these patients in September, and those patients actually were immune compromised patients, and they received convalescent plasma treatment as well as remdesivir treatment. So basically you have a patient whose immune system is very weak, cannot generate enough antibody. So he has viral loads at a high level in his body for a long time, 2-3 months. And then there was an intervention with convalescent plasma treatment as well as remdesivir treatment. So basically the virus titer is still high, and then you're adding additional pressure, additional selection pressure on this virus. And because it's all like treatments, like foreign intervention, not the immune system naturally generated from this patient's body. So the virus can have opportunity to select escape mutants. That's called escape mutant, because it can escape the large volumes of convalescent plasma, which include a lot of polyclonal antibodies against different part of the virus, right? And as well as remdesivir, the target against the spike proteins. So because the virus population is high in these patients, so they can select escape mutant more effectively in this kind of environment. So if a mutant escape from this kind of situation, it means this mutant can survive the regular polyclonal antibody against previous circulating virus strain, as well as it can escape the antiviral drug treatment. So these mutants become very potent, right? So now, if people are being infected with these new variants, maybe the remdesivir treatment no longer work for this patient, and maybe even if you adding convalescent plasma for these patients, it doesn't work. If people have severe symptoms with new variants, convalescent plasma won't work too. So that's why it's not exactly just the mutants that's really alarming. How the mutant was generated is probably more critical, because it tells the virus is trying to penetrate through people's immune system, immune defense system, and now they have some very powerful combination of mutants that can break through people's immune system. And that's probably another major reason that even young people's usually they have stronger immune systems and they got infected, especially people in the 20s, then more people got infected. And then why more teenagers, even kids got infected. So that's also related to probably the virus spike protein might develop better affinities with other co-receptors on the cell surface. Because usually, right, we know the spike protein from the coronavirus binding to the ACE2 receptor, and the ACE2 receptor usually express at higher levels when people are getting older or people become adult, right? So it's the number of ACE2 receptor on the respiratory tract cell surface is higher in adults than in kids, in the teenagers as well as in children. So that's why the virus doesn't have a lot of receptor to welcome them for infecting into people's epithelial cells in the respiratory tract. So if the virus mutated, so you have higher affinity with ACE2 receptor, so then probably more children will get infected because it's more potent, right? And alternatively, if the virus can use other co-receptor more effectively. Yeah, so there's two potentials too. So this is also very alarming as well. So we need to really be careful for children and teenagers, because a lot of the children or teenagers, they will have flu-like syndrome during this cold winter, right? Many people may not pay attention to it because they're kids. They always feel after a while, I will recover. No problem. This is just a small flu. Just maybe have a good rest for a few days. I will recover. But this time, really need to be careful to distinguish your symptoms from the COVID-19 infections. So it's better to have your parents help you to get COVID-19 test as soon as possible if you have similar respiratory symptoms. So that's why I think these mutants, when it can infect young people, infect children, suggesting the virus has certain degrees of breakthrough human immune defense system, probably develop new immune evasion mechanism. So of course, this is my hypothesis right now. So need more study to investigate on that. And right now, no official data to predict whether the new mutants will causing more severe disease. So of course, it's just newly emerged waves in the United Kingdoms. But I think soon we will see some of the clinical reports to see if overall more people have severe symptoms. Right now we see higher hospitalization rate, and that's really worrisome for many people and create a lot of burden for the medical system in the United Kingdom. But if more deaths keep climbing, then that would be a huge hint that the virus not only has higher transmissibility, but probably has more severe pathogenicities. So this is a key issues here. So I want to also show you this figure. So this one, we can see the mutants in UK become so dominant, and it's also very distinct from other mutants. In this diagram, we can see these green ones. Let me get rid of the previous marker. So this green one is the UK's new mutant clusters. And the orange one is the South Africa's cluster. And you can see they too derive from different ancestors. Quite distinctly different, but it's very interesting. They all have these N501Y mutants. That means that mutant is very critical in modulating the spike protein's interaction with the ACE2 receptor. But it also suggesting that other mutations are very important to contribute to virus better immune evasion or better infectivity. So but in here, I want to show this picture to see even these two mutants derive from two continents, but very interestingly, they have similar mutation, but of course, they are quite distinct mutants. So virus in every continent is not resting. They are actively trying to break through human immune system. So this is a global challenge. Okay, now let's look at the vaccine situation. So of course, right after mutant emerged, many people are being worried for the current vaccine developments, whether the current vaccine's effectiveness will remain as potent as it can be when facing the challenge of the new mutants. So if we, this one is also about the Africa mutant strain. So in this African mutant strain, let me just say a few words here. So basically, you have E484K mutant as well as K417 asparagine mutants. So these are three important mutants in the spike protein for the South Africa strain, and the let me see. So the E484K is also in the receptor binding motif. So these two important mutant in the receptor binding motif. Okay. So regarding about the vaccine, let's back to the topic of vaccine. So regarding about vaccines, of course, people put a lot of hope on the vaccine developments. And originally, United Kingdom's ordered 5 million vaccine doses from the Pfizer and BioNTech company. So this is a large volume order, 5 million vaccine kits, and they were promised to be delivered by the end of the year. But right now it's already at the end of the year. So far, United Kingdom only have about 600,000 people being vaccinated with this vaccine from Pfizer and BioNTech, and that's the mRNA vaccine, and which also requires -70 degrees storage. So it's quite a challenging logistic-wise. Another probably encouraging news is the United Kingdom's also being promised to start the delivery of the second vaccine that's from Oxford University and AstraZeneca, and that vaccine is an adenovirus-based vaccine. So basically using adenovirus as a backbone and putting a coronavirus spike protein in there. So this is a virus vector vaccine. So these new second vaccine will start the delivery in UK on January 4th. But overall, what will be the efficacy for these vaccines? And right now we know by a preliminary report on the phase 3 trial for the Pfizer vaccine, the initial data showing the protection it can be reached to 95%. And of course, this is very encouraging. But as we just discussed, the new mutants has potential to create, or you can say alter, the conformation of the spike protein as well, maybe other non-structured protein like the open reading frame 8, and as well mutation in the N protein will change the virus particle structure as well, and also change its interaction with other host factor too. So in this way, the virus still has a chance to have a higher immune evasion capabilities when it comparing to the circulating strain in the past. So all these RNA vaccines, the Pfizer vaccines, as well as the Moderna mRNA vaccine, they all designed based on the previous circulating strain. So of course they don't have these particular mutants. And by using this mRNA platform, they can upgrade the vaccines. So that's one convenient thing for using mRNA platform. But at the same time, because it's only limited to or part of the virus genome, so it doesn't include the mutation in other part of the region, like open region 1AB or even in the M protein. So other mutants, other mutations causing different change may not be addressed by the current vaccines, right? Because the vaccine primarily focus on the spike protein. So even though the vaccine will generate polyclonal antibodies, but people may not be able to, people's immune system may not be able to develop strong antibody defense after vaccination that can handle the challenge of the new variants. And so I'm still very concerned about the vaccine efficacy, especially right now, these mutants showing it can infect different age groups, and also we mentioned about even influence the virus detection in the nucleic acid assays. So all these suggesting the virus capability is has been evolved a lot. So let's look at another figure. Let me turn off these. Okay. So, based on the report from the London School of Hygiene and Tropic Medicine, and so they actually have a forecast regarding about total deaths in the next few months. And I want to share this data with everyone. But of course, this is modeling based on epidemiology studies. But I think it can give us a preparedness in our heart what kind of difficult situation we will face in the early 2021. And you can see even if it's in tier 3, in tier 1 and tier 3, because the report was right in middle of November, so they still talk about tier 1 and 3, but right now it's already tier 4 with school open, but maybe very soon it's in tier 4, the school closed. So you can say the peak deaths, daily peak deaths can be from 800 to 1,000 people, and total deaths can be as high as 100,000 or 115,000 people total deaths. And so, of course, this is a huge challenge for United Kingdom. Even if you have immunizations, for example, occur with 200,000 people immunized every week, you still got 83,000 people die. And so that only means only 20,000 people probably will be protected by the vaccines. And if 2 million people can be immunized, then maybe only 35,700 people die. But this is under the prerequisite that the vaccine can protect the variant, the mutants. So even these statistic models did not give any optimistic view on the challenge that we will face in the next, maybe even just next month or next 2 months. So I think these reports focus on the United Kingdom, but we haven't seen reports coming out of the South Africa. And South Africa situation can be even a bigger challenge, because South Africa has already had a peak in summer, and because South Africa has a huge burden of HIV and tuberculosis in the last few decades. So in South Africa, a lot of people are immune compromised because of the HIV and TB. So you have a large pool of immune compromised people in South Africa, and you have a very potent mutants in there. And that's why the mutants, the South African mutant has been found to be dominant to like 90% circulating in South Africa, while in UK it's probably about 60 to 70% dominant by the new mutants. So South Africa's situation may be even worse, and some of the people may already travel to other countries, so the new potent mutants may spread to the other country as well. So definitely, globally, more and more research institute or commercial company need to intensify their sequencing efforts, their surveillance efforts to identify the mutants may be landed in their own countries, and because it's like a very poisonous mutants coming out of a very poor protection environment. So it can spread faster, and the mutants can have better chance to develop mechanism for immune evasions. And so I think South Africa is a hotbed for very potent mutants. And right now, we see these important mutants already emerge, and it may further evolve too. And that's why really challenging at the end of the year 2020. Globally, even though more than 50 countries have closed their borders against the British traveler, but what about South Africa, and what about other countries in Africa? And we see the African unions also started taking some measures to alert other African countries about the COVID-19 widespread situations in South Africa. But the overall health systems in Africa is much weaker than the developed countries. So will we see a major outbreak in African continents? And then it will further have delivering huge impact to the global countermeasures, global response to the COVID-19, a huge second wave. We don't know, but I worry about the situation, and so definitely I will pay close attention to the situations in the United Kingdom, as well about the sequencing efforts in different countries, and I think everybody need to do some preparation if the situation getting worse in early next years. And so, in today's program we talk a lot about these mutants as well as potential impact on the vaccine's efficacies, and hopefully it will ring a bell for everyone, and everybody need to be cautious in this holiday season and need to take more active protection measures. And so we have to pray for the situations to getting better. Otherwise, it may be a devastating situation. But I don't know right now. But just saddening to talk this kind of topic right now. But it may happen, and we need to take additional serious precautions in terms of the COVID-19's major wave coming in. All right, that's all for today's program, and thank you for watching. This is Shanling. We'll see you next time.